I'm Dr. Chip Cole, a quadruple board-certified oculofacial plastic surgeon, and today we're going to talk about festoons. Festoons are caused by a combination of swelling inflammatory fluid that causes a malar bag, and in addition to that, a disorganization of the muscle fibers so they're not tight. So it's really a further worsening of malar bags that includes the muscle tissue. Festoons are not caused by a lack of sleep, but certainly if a person already has festoons, they will be worsened by a lack of sleep. To remove a festoon, it typically requires a surgical procedure because you have to tighten the muscle layer and you also have to adjust the ligaments that are binding the fluid in that region. Festoons can be treated first by a laser, and if they're mild, a lot of times that's all you need. If they're a little more involved, then you need a surgical approach behind the eyelid and also a laser on top of the skin, what I like to call an inside-out approach. The only reasonable way to reduce festoons is to take away things that cause inflammation. Most common would be alcohol. But when a person develops festoons, they also have damage to their eye muscle. And the muscle in the eyelid needs to be repaired to get rid of the festoon. Festoons do not go away on their own because you have damage to the muscle in the eyelid region. The swelling can improve, but unless you tighten the muscle layer, the festoon will still be present. Please make sure to subscribe. Fortunately, festoons can be corrected with surgery, but it involves very complex surgery because there's an inner layer of muscle and an outer layer of skin, and unless those two are treated individually and balanced, the festoon will not go away. Festoons are caused by a weakening and change in the muscle layer and also accumulated fluid around the ligaments. They're not composed of fat, although fat is very nearby. So a lot of times when we correct a festoon, we correct the fluid and the fat and the ligaments. A laser can significantly improve a festoon, but it will not get rid of it because it doesn't treat the damaged muscle. If there's swelling primarily, as in a malar bag, then the laser has a lot more effect on that tissue. For treatment of a festoon, it's very important to go to a doctor that has a lot of experience around the eye and mid-face and cheek region. An oculofacial plastic surgeon does that. A facial plastic surgeon does that. Most others do not see something that complex very often or ever in their career.